Some of the most dangerous substances in circulation today didn't come from a dealer. They came from a prescription pad. But when they're taken outside the conditions they were designed for, the same chemistry can become dangerous. The dose changes, the purpose changes, the supervision disappears. And sometimes the drug is mixed with substances it was never meant to meet. The consequences can be completely different. This is about understanding what these drugs actually do, why they get misused, and what the real risk looks like. Opioid painkillers. Oxycodone. Oxycodone is an opioid painkiller prescribed for moderate to severe pain after surgery, injury, or serious illness when non-opioid options are not enough or not appropriate. It works by binding to opioid receptors in the brain and spinal cord. It doesn't block pain at its source. It changes how the brain registers it. That same switch that dulls pain can also produce sedation, calm, and euphoria. For some people, the feeling isn't intense pleasure. It's the first moment in years their brain stops hurting. With repeated use, tolerance can build. The same amount may stop working as well. Physical dependence can follow, and withdrawal can be brutal. Overdose happens when breathing slows until the body can't sustain itself. The common misconception is that a prescription makes it safe. It doesn't. Oxycodone is a controlled substance because the potential for dependence, misuse, and overdose is real. Oxycodone manages severe pain effectively. Misuse turns that same mechanism into a path toward dependence, addiction, and overdose. Vicodin. Vicodin is a combination painkiller. It contains two ingredients, hydrocodone, an opioid, and acetaminophen, the active ingredient in Tylenol. Hydrocodone works on opioid receptors. Acetaminophen works through a different pain relief pathway. Together, they can provide stronger pain relief than either component alone in some settings. What makes Vicodin distinctly risky is that both ingredients carry their own danger. Hydrocodone can suppress breathing. Acetaminophen can quietly destroy liver tissue, slowly enough that people may not realize the damage until the liver begins failing. People tend to focus on the opioid and overlook the liver risk entirely. Excess acetaminophen, especially when combined with other products that contain it, can cause severe liver damage. Vicodin carries two separate risks. Misuse of either ingredient compounds the danger. Percocet. Percocet is another opioid and acetaminophen combination, this time pairing oxycodone with acetaminophen. It's commonly prescribed after surgery, dental work, or injury. Percocet often enters someone's life at a vulnerable moment during recovery when pain is real and the relief feels necessary. But the brain can start adapting to the drug quickly. Sometimes the injury heals before the brain stops needing the drug. Misuse carries both opioid overdose risk from the oxycodone and liver toxicity from the acetaminophen. Neither risk is secondary. Percocet solves a pain problem. When misused, it creates two separate physiological dangers at once. Fentanyl. Fentanyl is a synthetic opioid used for severe pain in surgical settings, cancer care, and end-of-life treatment. It works through the same opioid receptor pathway as morphine and oxycodone. What makes it different is potency. Fentanyl is estimated to be 50 to 100 times more potent than morphine by weight. That's not just a stronger version of the same risk. The margin between a working dose and a fatal one is extremely narrow. In many overdoses, the person simply becomes quieter, slower, sleepier, until oxygen deprivation shuts the body down completely. Fentanyl's potency is exactly the point in controlled medical settings. Outside those settings, especially when illicitly manufactured fentanyl is mixed into drugs without the user knowing, that same potency becomes a major driver of fatal overdose. More fun. Morphine is a natural opioid derived from the opium poppy. It's been used in medicine for over 2 centuries and remains central to hospital care, surgery, and palliative treatment. It relieves pain and creates a calm that can feel less like a high and more like emotional relief. For some people, opioid misuse begins less with euphoria than with relief from physical or emotional distress. With repeated use, tolerance can build, physical dependence can follow, and withdrawal can become extremely difficult. Overdose risk is the same as with other opioids, breathing slows, and oxygen drops. Morphine's medical value is real. Its capacity to produce dependence runs through the exact same pathway as its therapeutic effect. Codeine. Codeine is a mild opioid prescribed for pain and as a cough suppressant. It's often seen as the least serious opioid on this list. The word mild changes how cautiously people treat the drug, long before the body starts converting part of it into morphine. Codeine is a prodrug. During metabolism, the body converts some codeine into morphine, mainly through the CYP2D6 pathway. How much morphine gets produced depends heavily on genetics. Some people convert very little, others convert it rapidly, making the same dose far more potent than expected. That unpredictability is what makes codeine genuinely risky. Misuse can produce dependence, slowed breathing, and overdose, particularly in fast metabolizers. Calling codeine mild doesn't make it safe. Its conversion to morphine in the body makes the effect variable and potentially dangerous. Benzodiazepines. Xanax. Xanax, the brand name for alprazolam, is prescribed for anxiety disorders and panic attacks. It works by enhancing the effect of GABA, a brain chemical that slows neural activity and produces calm. For someone living in constant panic, Xanax can feel less like getting high and more like finally being allowed to exist normally. Thoughts stop racing. For a while, the brain stops feeling under threat. That relief is real, and it's also exactly what makes the drug hard to stop using. Regular use can lead to tolerance and dependence. High doses can cause memory problems or blackouts. Abrupt withdrawal after heavy or prolonged use can trigger dangerous seizures. Xanax becomes far more dangerous when mixed with alcohol or opioids because the combined suppression of the central nervous system can turn fatal. Xanax calms quickly and effectively. That same speed is part of why dependence can develop so fast. Valium. Valium, the brand name for diazepam, is prescribed for anxiety, muscle spasms, certain seizure disorders, and alcohol withdrawal. It works through the same GABA mechanism as other benzodiazepines. What sets Valium apart is how long it stays in the body. Diazepam and its active metabolites can remain active for days. Because of that long duration, sedation and impairment can accumulate quietly. The person may feel only slightly slowed down while coordination, reaction time, and judgment are already shifting. Stopping Valium abruptly after regular or heavy use can cause serious withdrawal, including seizures. Its long-lasting effects can make both intoxication and withdrawal harder to recognize than people expect. Valium can be medically useful and even life-saving in the right setting, but its long half-life means the calm can stack quietly in the background. Klonopin. Klonopin, the brand name for clonazepam, is prescribed for panic disorder and certain seizure conditions. Its longer half-life produces steadier blood levels than Xanax, which can be useful for ongoing anxiety or seizure management. It works by enhancing GABA activity, calming the electrical overactivity behind both seizures and panic. For some people, the attraction isn't euphoria. It's the sudden reduction of panic, fear, or internal agitation. For people with severe anxiety, Klonopin can feel like relief and stability, which is also what makes dependence difficult to break. Regular use can cause slower thinking and memory problems, while combining it with opioids or alcohol greatly increases the risk of dangerous breathing suppression. Klonopin reliably calms overactive brain activity. The risks of dependence and cognitive effects are real and often underappreciated. Adderall. Adderall is prescribed for ADHD and, in some cases, narcolepsy. It's a combination of amphetamine salts. It increases the availability of dopamine and norepinephrine in the brain. For people with ADHD, this can help regulate attention, impulse control, and executive function. The brain that struggled to stay organized can now hold focus. Outside medical use, Adderall is often misused for focus and productivity. Over time, it can make people feel that performance and control depend on the drug. Misuse can lead to insomnia, anxiety, heart strain, psychosis, and dependence as the brain adapts to functioning with the drug. Adderall serves a legitimate purpose when prescribed. Using it outside medical supervision may bring risks without the safeguards of diagnosis, dosing, and monitoring. Ritalin. Ritalin, the brand name for methylphenidate, is prescribed for ADHD and narcolepsy. It increases focus by keeping dopamine and norepinephrine active in the brain longer. The effect can feel subtle enough that people underestimate how strongly the brain is still adapting underneath it. Ritalin mainly blocks the reuptake of dopamine and norepinephrine, while amphetamines also promote release. Its mechanism differs from amphetamines, but misuse can still carry serious risks. Ritalin is often misused for focus and performance, carrying risks like anxiety, heart strain, sleep disruption, and psychiatric symptoms with prolonged or high-dose use. Ritalin's mechanism differs from amphetamines, but the risks of misuse run parallel. Different is not the same as safe. Vyvanse. Vyvanse, The brand name for lisdexamfetamine is a prodrug prescribed for ADHD and binge eating disorder. It only becomes active after the body metabolizes it. After ingestion, the body converts lisdexamfetamine into dextroamphetamine, the active stimulant. A slower onset changes how the stimulant feels psychologically. It may feel smoother and less abrupt, but the active compound is still an amphetamine. Once activated in the body, Vyvanse carries the same categories of risk as other amphetamines, including insomnia, anxiety, heart strain, and dependence. The prodrug design changes the timing and onset. It doesn't change the fact that the active compound is a potent stimulant with real consequences when misused. Special case: gabapentin. Gabapentin is a medication for nerve pain and seizures that works by calming excessive nerve activity in the brain and nervous system. Because it doesn't fit neatly into the opioid, benzodiazepine, or stimulant categories, many people assume it's harmless. Because it isn't viewed like an opioid or a benzodiazepine, people often underestimate how dangerous its sedative effects can become once other depressants enter the bloodstream. Gabapentin can cause sedation and cognitive impairment. When combined with opioids, alcohol, or other depressants, it can increase sedation and the risk of respiratory depression. Because gabapentin is often treated differently from opioids or benzodiazepines, people may underestimate it. Gabapentin is a legitimate medication. Combined with depressants, its sedative effects can become compounding and potentially fatal. Tramadol. Tramadol is prescribed for moderate pain. Its mechanism is different from standard opioids. It has weak opioid activity and also affects serotonin and norepinephrine reuptake, giving it a mixed profile. Part opioid painkiller, part serotonin norepinephrine reuptake inhibitor. Tramadol has a reputation for being the safer opioid. That reputation often changes behavior faster than it changes the chemistry happening inside the nervous system. It can still cause dependence, withdrawal, and respiratory depression. And because it affects serotonin, it can interact dangerously with serotonergic antidepressants and increase the risk of serotonin syndrome. Seizures are a distinctive and underappreciated risk. They've been documented with tramadol use, particularly at higher doses. Tramadol's milder reputation is partly accurate and partly misleading. Its unusual chemistry introduces risks that standard opioids don't carry.